Okay. Hello everyone, my name is Carissa Gibson. This is my senior project on reducing CLABSI, central line associated bloodstream infections, for those who don't know. At the abstract, this PowerPoint is going to discuss central line associated bloodstream infection, what it is, why it's essential to reduce CLABSIs. It's also going to discuss why we need to change and what it's going to do to affect patient outcomes in the facilities. Stop CLABSIs. So what is a CLABSI? Well, it's a central line associated bloodstream infection. It occurs when bacteria, these little guys, they get inside either the site or they go up the line and they get in the patient's bloodstream. It happens when bacteria grows in or around the site and spreads into the patient's bloodstream. It's just a little citation. So CLABSIs, they cost hospitals millions of dollars every year. They're preventable infections, as we know. If we use proper techniques, they can be avoidable. AHRQ reports that the estimated cost of one CLABSI infection is $45,000, $254, or something like that. Yeah, I said it wrong, but that's how it says. So if you have, 15 of those a year, you're in millions of dollars. And insurance companies do not reimburse for CLABSIs, CAUTIs, any hospital-associated infection. CLABSIs amount for more than 1/3 of all of the hospital-acquired illnesses. They have increased costs for patients, hospitals, increased length of stays for patients. They have very high mortality rates for patients. This is death. He's coming. So why do CLABSIs happen? There's a whole plethora of reasons. Poor hand hygiene, people not washing their hands with warm soap and water, not doing it properly, not using alcohol-based hand sanitizers, improper insertion techniques. Maybe it's a rushed emergent situation and people don't go in sterile procedure gown, gloves, nets. Breaking sterile environments, huge. Many times I've seen physicians, nurses, they do a sterile procedure, they mess up, they don't feel like going out and getting another kit, so they keep going with the same kit. Huge risk for infection that way. Inappropriate skin preparation. We're not using the right cleaners. There's all kinds of evidence out there. I will discuss later in the presentation the best method. Rushed procedures, again, emergent situations. Everybody's hands on deck trying to get a central line in place and things happen. Improperly trained nurses and physicians. You want people who are educated on the procedure to be at the bedside when the patient's doing. This is an important line. It goes directly into the bloodstream to the patient's heart. This is a germ and he is angry and he's coming for you. Is he cute? Alright. So why is reducing CLABSIs important? It's important for patients, number one, because it's all about patient care. We don't want patients to get CLABSIs. The death rate on them is extremely high. Hospitals. Hospitals are burning money, losing money. They're not getting reimbursed from insurance companies, and that money they're burning on CLABSIs, they could be spending on different areas. Improvements in ERs, improvements for patients, anything. It could be used anywhere else. What else do I got here? Save hospitals' monies, yes. Improve patient outcomes. Alright. I think that's about all that. Alright, my personal obligation to this. So I see many central lines placed improperly since working in the ER. Most of the time they're rushed procedures. And everybody's coming in chaotically and things are getting grabbed. Everyone's trying to get their hands into the situation to help out and things happen. Other times it's you need it done quickly, and I see physicians, not wearing a cap, not break-in sterile procedure, and they don't even care because they want to get it in. I think it's important to me that we protect our patients as nurses and we advocate for them. We need to make sure that the physician is doing the right thing. That's our job. We're the voice of the patient while they're doing this procedure. They don't know what's supposed to happen. I've treated many patients for sepsis and CLABSIs. CLABSIs can lead to sepsis. It's terrible. It's a life-threatening disease, and I hope that with my project I've initiated, we can help knock out some of them. Same thing, advocating for my patients. So what needs to change? Change. No nurse likes to change. Alright, number 1, we need to maintain sterile fields. No matter what the situation, emergent, non-emergent, we need to make sure no one's breaking a sterile field. And if we see a physician, we need to speak up. We need to say, hey, you just touched that, your glove's not sterile. Get them a new pair. Let them put a new pair on. Proper insertion techniques by physicians. If they do use the ultrasounds, sometimes I see physicians not put the sterile cover over the probe, and they just use the direct probe on the skin. We don't know how that's been cleaned. What is that going to do to the patient? Nurse and physician education should be a yearly requirement to go over central line insertions, a renewal for the physician and a renewal for the nurse on how to assist the physician and what to look for. Pre-packaged central line, or CVC, central venous catheter kits. These kits are amazing. It has everything you need for the central line in one spot. So before these kits were around, you used to have to go out and grab each separate piece from the different areas. Then when you came in and put it on your sterile field, you had to open each one. High risk for contamination that way. So these kits, they from evidence, it's really shown that it helps physicians prevent breaches in aseptic techniques. It reduces mistakes because everything they need is there. And the whole kit is sanitized and sterilized together. And research has shown that using these reduces the rate of CLABSIs. Hand hygiene, the number one thing we learn in nursing school, the number one thing that's taught. Wash your stinky hands. Warm soap and water. Get it good. Over here, on the back sides, in the fingers. How often do you see a nurse wash their hands? Not very often. They use the foam most of the time, but good old soap and water is the best. Important quote here. Hand hygiene is now regarded as one of the most important elements of infection control activities. It's been around forever. It's huge. Wash your hands. Before the procedure, when you're taking care of the line, when you're accessing the line, clean hands. Skin preparation. There's been all kinds of things used, from alcohol to iodine, but chlorhexidine, or ChloroPreps as we know them, is the number one thing we should be using. A lot of facilities now even use ChloroPreps just for IV insertions. They can look like this. They can look like the little things you have to snap and shake and clean your site. So you use those, the old school technique, in the circle all the way out. Watch the doctor. They do recommend that this is used before we insert the central line, and after the physician has inserted it, they go back and clean the area before we actually place the dressing. And research has proven that this is the number one skin prep for reducing infection. So, all of these items that I've just discussed, hand hygiene, maintaining sterile field, checking the procedure over, the ChloroPrep, using the pre-made kits. We need to use a checklist. We need to implement a checklist before every central line insertion. Utilizing a checklist will enable all the items that I've addressed to be done at each insertion. So the checklist, I've proposed that we use a checklist before each insertion. It'll have every item that the nurse needs to. The nurse would be the one running this checklist. It doesn't even have to be a physical paper. it should be at first until the nurse knows the procedure. Give me that drink, that ginger ale. My throat's killing me. Sorry, everybody. Alright. So, any nurse who's going to be at the bedside for an insertion needs to have the checklist. And on it, they would go through each item and make sure it's done. And make sure it's done before the central line is inserted. I recommend that before the checklist is implemented, that there's an education and briefing for the physicians, for all the nurses, where the area is going to be.
What the hell are you still doing here?
Sorry about that. I lost track. Alright, so all nurses have to have the checklist. Education for the staff who's going to be putting in central lines. And I suggest after that the checklist be made into a badge buddy that the nurse can keep on their badge for quick, easy access. So as nurses, we all can help. If you don't do them, you don't do them. Just advocate for your patients. Make sure the right things is being done at the right time. So my overall summary of this project, it shows that the implementation of a checklist of using all these items together reduces the rate of Class B infections in hospitals. And these are my references. Thank you for taking the time to watch my project. Alright, I guess.